Are you in final year MBBS or doing internship right now? Then let me tell you something I wish someone had told me. The biggest career mistake after MBBS is not failing NEET PG. It's discovering your options after you need them. And after speaking to thousands of MBBS students, interns, and NEET PG aspirants over the years, I have realized this mistake is becoming more common every year. Which is exactly why I believe UPSC CMS 2026 may witness the highest competition ever. Not because doctors are giving up on PG, not because CMS has suddenly become easy, but because doctors are finally planning beyond PG. And if you are preparing for the NEET PG right now, this video might completely change you how you think about your future. Hi everyone, myself Dr. Sagar Pushp. I am a surgeon and also cleared UPSC CMS. So I have completed my MBBS in 2019 during internship. I cleared both NEET PG and UPSC CMS. Today, I have completed my surgery residency, but the most important lesson I have learned wasn't from a textbook. It wasn't from a coaching institute. It wasn't from a residency. It was during that uncertain phase after MBBS. The phase where every doctor suddenly realizes that clearing an exam and planning a career are two completely different things. And that's exactly what we are going to talk about today. Let's start with the reality. 10 years ago, India had around 50,000 MBBS seats. Today, India has crossed 1.2 lakh MBBS seats annually. Think about that. The number of future doctors entering the system has more than doubled. Now let's talk about the NEET PG. This year, around 2.42 lakh doctors appeared for the NEET PG. Most students hear this number and immediately ask, "Sir, how many PG seats are there?" India currently has approximately 50,000 plus MD/MS diploma seats and 13,000 DNB seats, which means roughly 65,000 postgraduate training seats. At first glance, it sounds comfortable. 2.42 lakh aspirants, 65,000 seats. But here, where most students stop thinking, because students are not competing for all 65,000 seats. Let's be honest, most students want government college, clinical branches like medicine, surgery, radiology, and in a top institutes in a preferred cities. And that's where the bottleneck starts. Out of the total PG seats, roughly 32,000 to 33,000 are government PG seats. Now think about this, 2.42 lakh aspirants, 33,000 government PG seats. That means approximately 7 to 8 doctors competing for every government PG seat. And if we narrow it to further to top government colleges and top clinical branches, the competition becomes dramatically higher. And this is where the most students face a reality they never anticipated. The challenge is not getting a PG seat. The challenge is getting the PG seat you actually want. And that's where the uncertainty begins. Now let's compare the competition. Not to decide which exam is harder, but to understand why CMS is attracting so much attention. See about the NEET PG, 2.42 lakh aspirants, 65,000 total PG seats. That's approximately one PG seat for every 3 to 4 aspirants. But for the government PG seats, one government PG seat for every 7 to 8 aspirants. And for highly sought after clinical branches in top colleges, the competition becomes much more intense. Now let's look at the UPSC CMS. There are total 1,358 vacancies this year. Now let's calculate. Approximately 78,000 applicants, 1,358 vacancies. That means around 57 doctors competing for every one CMS seats. Let that sink in. 57 doctors for a single vacancy. That's roughly a 1.7% selection rate. And despite that level of competition, more and more doctors are entering the CMS ecosystem every year. Why? Because the mindset of medical student is changing. 5 years ago, most MBBS students knew only one pathway. MBBS, then they'll do the PG, they'll do the super specialization, they'll do the job. Today, the conversation has changed. Students are asking smarter questions. What if I don't get my preferred branch? What if I don't get my preferred college? What if I don't want multiple drops? What if I need a financial independence? What if I need to support my parents? What if I want job security while preparing? And what if I want options? And when students start asking these questions, they start discovering UPSC CMS, not as a backup, but as a career pathway. And that's the biggest mindset shift happening today. Earlier, students thought CMS or PG. Today, many students are thinking CMS and PG. And that one mindset shift is changing everything. And I know this because I lived through it. During internship, I've cleared both NEET PG and UPSC CMS. I was getting surgery, the branch I wanted, but not the institute I wanted. And suddenly I found myself standing at a crossroads. Should I compromise or take another attempt or start earning? Should I join government service? Should I keep chasing a better seat? For the first time in my life, the question wasn't, can I clear the exam? The question was, what kind of life do I want to build? As a first generation doctor from a middle class family, that wasn't an easy decision. Because there was no roadmap. Nobody was talking about career strategy. Nobody was discussing uncertainty. Nobody was discussing what happens when a plan A does not go exactly as expected. And that's when I realized something. The biggest challenge after MBBS is not competition. It's uncertainty. Now let's connect all the dots. More MBBS seats than ever before, more NEET PG aspirants than ever before, more awareness than ever before, more first generation doctors than ever before, more financial responsibilities than ever before, and top of all that, UPSC CMS 2026 has announced one of the highest vacancy counts in recent years, that is 1,358 vacancies. Now think from a student's perspective. If someone knows they can get a central government job, earn a stable income, gain experience, support their family, build financial independence, and still keep future PG options open, would more people consider CMS? Absolutely. And that's exactly what's happening. Students are no longer looking at CMS as a backup option. Many are looking at it as a strategic career move. And that's why I believe CMS 26 could witness the highest competition we ever seen. Every week I have received messages from doctors saying, "Sir, I have taken 2 drops. Sir, family pressure is increasing. Sir, I need to start earning. Sir, now I want to prepare for CMS." And every time I read those messages, I think the same thing. What if somebody had explained all these options during final year? What if somebody had explained this during internship? Because the students who suffer the most are not the students who fail. The students who suffer the most are those who have never planned uncertainty. They prepared for one possibility, life presented another. When I chose UPSC CMS, many people thought I was dealing my dream, but something interesting happened. I started earning, I reduced financial pressure, I gained confidence, I gained experience, and later I joined my surgery residency. Today, after completing my surgery residency, I can say something with complete honesty. CMS didn't replace my dream, CMS protected my dream, and that's a very different thing. Looking back, the best decision I made wasn't clearing CMS. It wasn't getting a surgery. The best decision I made was giving myself options, because options create freedom, and freedom creates better decisions. Today, more doctors are realizing the same thing. That's why CMS competition is rising. Not because doctors are becoming less ambitious, but because they are becoming more strategic. India is producing more doctors than ever before, which means competition is no longer just increasing, it's multiplying. Your career is bigger than one rank, bigger than one counseling round, bigger than one exam. So if you are in final year, internship, or preparing for NEET PG right now, don't wait for uncertainty to teach you what you should have learned earlier. Explore your options, understand your pathways, plan beyond a single exam, and remember this one line: after MBBS, don't choose the next exam by fear, choose it by life. So, comment below PG if you are focused on NEET PG, CMS if you are seriously considering UPSC CMS, and tell me honestly, what is your biggest concern after MBBS? I read your comment, and if this video helped you, share it with one MBBS friend, because one conversation during internship can save years of confusion later. Thank you.